Good afternoon. I am Dr. Alexander Diddick, and I wanted to talk to you a little bit about today about a new minimally invasive procedure for chronic vertebrogenic low back pain. This webinar is about the Intracept procedure. As our ongoing webinars with HealthU clinics, we want to inform our patients about the procedures we perform and ways we can help them with their chronic pain and ongoing medical conditions. I'm Dr. Alexander Diddick. I serve as the Director of Pain Medicine at HealthU Clinics since 2022. A little bit about me. I serve and take care of patients across Phoenix, ranging from Avondale to Glendale to North Phoenix locations. I'm born and raised here in Phoenix, Arizona, where I went to Arizona State University for undergraduate, went to medical school and got my master's degree at Midwestern University here in Glendale. Finished my family medicine residency program here in Phoenix, Arizona, at the Brazos Central Family Medicine Residency Program. Following residency, I completed 2 fellowships, the first in sports medicine in Southern California, followed by pain medicine in Pittsburgh, Pennsylvania. So I'm excited to talk to you a little bit about chronic low back pain. This is one of the most common reasons why patients are seen in their office as well as the emergency department, with over 30 million patients having chronic low back pain that's been lasting for 6 months. It's really important to focus on the duration of how long someone's been experiencing pain, because most problems and most pain complaints that patients have heal on their own. And once things start getting outside of their normal time period of healing, which could be 3 months, 6 months, 12 months, depending on the injury, we consider this chronic pain, or pain that's less likely to heal on its own, where the majority of patients don't actually improve once things have become chronic in nature. So 1 in 6 patients that we see for chronic low back pain may have what's called vertebrogenic back pain. And we're going to talk about what that is specifically, but largely it's a very severe form of degenerative disc disease. So let's have a little bit of better understanding of vertebrogenic pain. Vertebrogenic pain is a distinct type of chronic low back pain caused by damage to what is called the vertebral end plates. So in between each one of the bones in our low back sits a disc. Think of this as like a shock absorber. The part where the bone touches the disc is the vertebral end plate. The picture on the top right of the screen kind of shows this, looking at a disc and an end plate. Now, every part of our body is innervated or has nerves that have sensation that go to it. Simply, there's wear and tear that can occur or degeneration to this area where the vertebral body meets the disc at the vertebral end plate. When this occurs and when it becomes more severe, this can be painful. The nerve that goes to the vertebral end plate is called the basivertebral nerve, or for short, BVN. Now, this is found within the bones of our low back, the vertebral bodies, and this will carry a pain signal from your back to your spinal cord up to your brain. And this is very important because pain is not experienced until it reaches the level of our brain. And so this treatment modality that we're talking about today, the Intracept procedure, is a way of blocking that pain signal by doing a radiofrequency ablation, where we burn this nerve within the vertebral body that senses pain that goes to the disc. If that doesn't sound like a mouthful, it quite is. Now, the basivertebral nerve within the vertebral body can be inflamed or irritated or have edema or swelling within it. And this is an important finding because this defines vertebrogenic mediated back pain. Now, vertebral mediated back pain, it presents very similar to degenerative disc disease. The pictures below give us a good idea of what this would be. If I have chronic disc-related back pain, it may be worse with activity. It may be worse with sitting, bending, lifting, putting our shoes and socks on in the morning. Often patients can't sit still or find a position that they find that relieves the comfort. It's in the middle of the low back, and it's made worse by all of these activities. So who is a candidate for the Intracept procedure? Who are the patients we're looking at who may have vertebrogenic mediated back pain? Now, we already talked about that chronic low back pain has been going on for at least 6 months, but there's one big caveat to that. We want to have been doing conservative management during the ongoing back pain. So patients are often trying medications, physical therapy, home exercise programs. We'll often do injections such as epidurals. They may have seen a chiropractor or an acupuncturist, and that pain is still not getting better. And if the pain is not getting better, then we want to come up with a permanent solution that can relieve their pain indefinitely. Now, if I get an MRI on someone's low back who's been having ongoing chronic low back pain, it's been refractory to conservative management, it's going on for over 6 months, and I get an MRI and I see swelling or inflammation at those vertebral end plates, it'll look like the image on the right. Now, what we're looking at on the right is an imaging of the lumbar spine on an MRI. And I don't assume all my patients know how to read an MRI, but where there's orange circles, you can see there's a difference in the color within the bone. And that's a picture of swelling and edema. So to just frame this a little bit, those big squares are the vertebral bodies, and the darker lines in between are the discs. And the area above and below the disc within the orange circle represents modic changes, which is, again, inflammation and swelling within the bone that is indicated for vertebral mediated back pain. So let's talk about a little bit about the Intracept procedure. What would we be doing to relieve the pain? This minimally invasive same-day procedure can be done very similar to many of the procedures we do for the back. Ultimately, from a patient perspective, a patient's laying down on their stomach, we're cleaning them off with a little bit of soap, we're numbing the skin. There may or may not be some sedation or some medication to help patients relax. We use an X-ray camera to help guide us to the correct location where we will be going within the vertebral bodies or within the bones to get to that BVN or that basivertebral nerve to burn those nerves. The Intracept procedure relieves the vertebrogenic pain by heating or burning the BVN with a radiofrequency probe to stop the pain signal that goes to the brain. So if I have back pain, again, that back pain signal goes from the vertebral bodies to your spinal cord. That spinal cord then sends a signal up to your brain. If I block that signal at the nerve that's in the vertebral body, that signal never reaches your brain. And patients will ask me, well, what happens if I don't experience pain? And my general response is you feel a lot better. And the reason why that is chronic pain is not helpful. Chronic pain is dysfunctional pain. Helpful pain is if I had my hand on a hot stove and I need to remove my hand so it doesn't burn. Helpful pain is if I broke a bone and I'm not supposed to be walking on that foot until the bone heals. Chronic low back pain, or definitely in the case of vertebrogenic mediated back pain, is dysfunctional pain. It doesn't help you. It only makes your life worse. And so if I can improve your quality of life by limiting the amount of pain you experience, that's a good thing for our patients. So the Intracept procedure is a minimally invasive and implant-free way of doing this, where we do one time, go into the bone under that fluoroscopic or X-ray guidance, and we ablate that basivertebral nerve. All of this is done under local and light sedation, and the procedure is generally done within an hour. Again, just to review this, it's a very minimally invasive procedure where there's two small incisions that are made about smaller than half your thumbnail. Ultimately, what we're trying to do is get within those vertebral bodies, and we need to be able to guide two trocars into the bone. And we'll go through this as well. I have a video to share with you to look at this further. Here's that video.
Meet the Intracept procedure by Relievit. Living proof for millions of people suffering with vertebrogenic chronic low back pain that finally relief is here. The Intracept procedure is the only FDA-cleared procedure available for proven, durable, and safe relief of chronic vertebrogenic low back pain. Traditionally, treatments have focused solely on discs as the source of pain, while new research has shown that end plates are more highly innervated than the discs. Over time, disc degeneration and everyday wear and tear produces stress and damage to the end plates, allowing pro-inflammatory disc tissue to leak into the bone through the end plates, leading to inflammation. This inflammation is a biomarker visible on MRI, referred to as modic changes. Type 1 and Type 2 modic changes directly correlate with chronic low back pain. The basivertebral nerve, or BVN, carries pain signals from the inflamed end plates to the brain. The Intracept procedure involves heating the BVN with bipolar radiofrequency energy to stop it from sending pain signals. This creates a lasting effect, because unlike facet ablation, where the nerves grow back, the BVN has not shown an ability to regenerate functioning nerves following the procedure. The Intracept procedure is performed in an outpatient surgery center and generally lasts about an hour. Most people resume normal activities quickly and start to feel pain relief within 2 weeks. Unlike more invasive surgeries, the Intracept procedure is implant-free and preserves the overall structure of the spine. It also has a well-established safety profile, equivalent to steroid injections, and demonstrates significant improvements in function and pain, sustained more than 5 years after a single treatment. The Intracept procedure by Relievant, the only procedure for proven, durable, and safe relief of chronic vertebrogenic low back pain.
Okay, that does a great job of explaining, give you a visual representation of what we've been talking about. We'll finish up this webinar and kind of go through a few more slides. So to review the procedure, so we gain access within the bone where the nerve lives, the basivertebral nerve. We create a channel within that bone to allow access to that radiofrequency ablation probe. That probe is what heats up and burns that nerve. And that's why we do this often under some light sedation to make it much more comfortable for our patients. We burn the nerve over the course of a few minutes, and that nerve cuts off the supply or the signal that can kind of travel back up to the spinal cord to the brain. That nerve dies off over the course of the next few weeks to few months. And ideally, it doesn't grow back. So outcomes related to the Intracept procedure. A third of patients who are diagnosed with vertebrogenic mediated pain who undergo the Intracept procedure are pain-free. A third are about 50 to 99% reduction of their pain, which is very significant. And a third of patients have up to 50% of their relief of pain. Now, back pain is quite complicated. Patients can have more than one pain generator going on at the same time. So with a lot of confidence, if a patient's presenting with degenerative disc disease or vertebrogenic mediated pain, we can be very comfortable to say if a patient has modic changes and end plate mediated changes on an MRI that goes well with their symptoms, that this procedure will be very effective. Let's talk about expectations. Ultimately, at a 5-year follow-up, 2/3 of patients have resumed full physical activity from this procedure. For a procedure that's this minimally invasive in the setting of someone with chronic low back pain, that's astounding. That's a wonderful statistic, which shows that 2 out of 3 people have very significant improvement of function, not just pain. Over 80% of patients who undergo the procedure are very satisfied with the procedure, so 4 out of 5. And the time period for relief starts at about 2 weeks as that nerve dies off and continues to cause reduced pain over the next 3 months as that nerve continues to die off. Over 20,000 patients have undergone the Intracept procedure, and that number is only going up more and more. If you'd like to find out more about the Intracept procedure, you can scan this QR code as well that kind of gives you more information about vertebrogenic mediated pain. There's also a series of patient testimonials as well. You can always reach out to me in my office. Again, I'm Alexander Diddick. I work for Health U Clinics. There's our phone number and website at the bottom of the screen as well.